worked in social and community services for very many years, I first became really interested in the value of adult learning for anyone actually who needed support as perhaps an older person or a vulnerable person. When I went to a conference in London and the keynote speaker said that one session of adult learning equated to one less visit to a GP, I was really taken with that, and when I went back to work I thought it was really important that we started to investigate and research that and look at how we could add health and well-being as part of a package to the people that we delivered services to.
We've had a lot of clients that have been really keen, and you know, it's produced a great sort of partnership with the Oxfordshire Skills and Learning Centre, and the clients have really benefited. It's helped with their independence and their well-being. It's been a wonderful success actually.
The reason why we need to work in partnership is to divert the funding to those most in need, but also, for example, the health and wellbeing centres want to support people in older age to keep active, and we have a service or a product that can help them to do that, so we can take activities into the health and wellbeing centres to help people to keep active. So for example, the seated yoga.
I've done exercises for a long time, but not yoga. And I find that this is much more beneficial than the ordinary things that I used to do.
It's really, really simple stuff. But if you've not done it before, you know, you say to them, sit up, how are you sitting in your chair? It's not just sitting in the chair, how are you sitting in the chair? Okay, I can sit up nice and straight, you know. And while you're sitting there, don't forget to move your ankles every so often, and it's made such a lot of difference.
Well, I was in a wheelchair about 2 years ago. I totally relied because I didn't have the strength and really the will to go out without it. And coming here, it is strength to me. It's weaned me off the wheelchair. I still use it occasionally, but not half as much as I used to. It has improved my life tremendously. I can go out on my own, whereas before I relied on my wife to take me out. I can venture it on my own, and I really enjoy it.
Well, we were one of the lead organisations involved in the previous Rural Focus project, so we were really pleased to be involved. We didn't have the dementia experience, so our partners brought in that. We had the community development and the rural reach, and actually it was very much a partnership project, which meant that we could have the breadth and the reach needed to succeed as we did with this project.
The organisations involved really work well together, we work to our strengths, and 5 heads are better than 1. Each group had the opportunity to do dementia training, so just making people aware of the sort of symptoms and what people would be experiencing with dementia. We did a lot of workplace training as well, so various supermarkets are now a bit more dementia friendly, their till staff. We did quite a few housing associations to enable and support their residents, so it was very much making small villages dementia friendly and providing services for people in their locality.
We can use our specialisms and we can use our knowledge of the local community and their needs, and we can really focus in a much more meaningful way, and there's less wastage, it's more concentrated, we're pooling our resources, not necessarily just financial, but also our knowledge.
We were sourcing first aid training for carers. It's really important that carers feel that they have the skills to continue in their caring role, and first aid is really important for them. It's easy for carers to become very socially isolated, to lose the social contacts that they've had before they become carers. And so we actually found that they were getting far more from the first aid courses than just the basic first aid skills. So they were incredibly valued and valuable to those carers.
It's really important for dementia not to be a taboo subject. People if they get diagnosed, it's the end of the world, the end of their lives, when actually the point of knowing more about dementia is that then you can communicate effectively and make sure that you are giving them a good day out. So the thing that I took away from the course as being the most important thing is the thing of when you take, say, my mum out, when you come back, she might not remember where she's been, what she's eaten, what she's done, but she's got a feeling that, yes, I had a good day. And it's that feeling that she will keep with her for some time. She won't remember what day I came, that's not important, but if she knows she had a good time when we went to eat lunch, then that's what it's about.